It's all yours.
Hi everyone, Julio from Brazil, Manaus, Amazônia.
Okay, everyone, welcome to the next monthly Wilderness Medical Society Student in this Group lecture series from the College of Remote and Offshore Medicine. I'm just going to start sharing my screen and we can start today's presentation. Just give me a second. Okay, so today's lecture is on evaluating fitness for wilderness travel. And basically, this is who I am. Those of you all who haven't been uh, here for the previous lecture, which I did on diving medicine. I'm a paramedic. I'm also a technical diving instructor, a diving emergency and medical responder, and I'm a form candidate. I'm also a DHS student, pursuing my doctorate in health studies from the College of Remote and Offshore Medicine. I'm also an associate lecturer there. So travel medicine is not just a single thing. It is a continuum, and it has it's kind of a ring, you would say, or a circle of events. And so this cycle, but however, is not just in unidirectional. It can also be also have parts coming in between. As you see, there's a pre-travel evaluation. There are advisories which come in between the travel and the post-travel as well. And then you have rehabilitation post-travel. So when I talk about travel medicine, and I want you all to understand this as well, that it is just not a single cycle, but you, as a medical provider, you constantly have to be on the ball with your patient or the person whom you're advising on what needs to be done and how it needs to be done. Of course, this will be different if you are in a remote situation where the patient or your client is not able to get back to you, or you are not able to send them any message, or communication is not the best. So the scope of my presentation today is as flashed. We will talk about pre-travel consultation, the various guides and resources available to us. Think about medical history for your patient and cover certain important aspects of it, demographics and how they affect your patient interaction, your advice to your traveler, how the location for travel affects your medical examination and your medical advice, the activity and fitness level, and risk management for situations, locations, and the activity. And then, of course, you will have a post-travel debrief, which I will cover, which again is the continuum of care. So start off with the pre-travel consultation. You need to have a full history of your patient. So you need to have a last complete medical examination, know when it was done. And in some cases, depending upon the activity, you might have an annual or a 6-monthly examination required by law or by an agency who is taking the patient, excuse me, who is taking the person for travel. And the history of prior travel is also important. Is it their first time going to a remote location? Is their first time going to a tropical environment? And so on and so forth. Are there travelers who are experienced, who know, who's basically understand that once you leave, you might not have access to your prescription medications unless you have a separate physician's appointment at a new location and things like that. So the next thing would be your location. And here again, I'm going to cover that in detail, but as a rough concept right now, think about location not just as location on the globe, but location as medically relevant, plus any kind of activity that they're going to do, which would be whether it's mountainous, whether it's mountaineering, high altitude, whether they're going diving, whether they're going hiking, or it's just a safari. And then also, when you talk about reason for travel and risk assessment, uh, there are quite a few people who travel for on missions, which would be humanitarian missions or military missions or any such missions. Even you have church missions and religious missions go out. So it's not just recreation. And when you look at those reasons for travel, you have to do a different kind of risk assessment based on the location and the kind of um, uh, risk that excuse me, risk that is posed to the client from the environment. And then, of course, medical insurance. A lot of places now do accept medical insurance, and the traveler can be covered by what you would call cashless insurance. However, it's also important to know whether the local area does cover and does accept certain medical insurances. So the other thing which you need to think about is the experience of the guide who's taking them, who's taking your client, and their medical training. In some places, you have to actually talk to the guide and talk to the agency taking the tour agency, for example, and understand what uh, level they have and what kind of medical kit safety equipment is being carried by them, what is the local uh, medical facilities available, and what you would recommend for your patient then or your client then in terms of medications, the medical supplies that they should carry, and any contingency plans. Now, medical supplies could be simple as carrying eardrops or dexamethasone tablets, or simple acute mountain sickness prophylactics, just stuff like that. Or it could be their own prescription medications if they're going for a longer period. Now, the CDC, or the Center for Disease Control and Prevention, has an online app kind of on link, which gives you quite amount of data if you try to do it yourself, and for your patients as well, and your clients. It's an easy uh, evaluation, which also gives you information for the location and what kind of vaccinations or immunizations that you need to be undertaking and taking care of. There is also the International Society of Travel Medicine, which has certain providers which are globally recognized and globally available. You need to just do a search for them on this website, and pretty much almost all the resources are available to you through them. They also have their own certification on global travel medicine for those who are interested. They have a exam, I think, once a year. Now we come to medical history. So as usual, a standard medical history would be any known allergies, any conditions that are pre-existing, which are under control, or whether they are not under control, which obviously means that they would have to have uh, prescribed medications or diet, compliance with lifestyle, and their treatment. And what's important also is to note if the patient has or the client has illness from a history of illness from prior travel, excuse me, which could be anything from GI related issues to carrying to malaria or carrying a parasite back home. And it of course depends upon what kind of immune status they have, and how and whether they're immune compromised or not, again, which would be covered under your overall medical history. The other important thing would be to make sure that their immunization is up to date. Do you have all their shots, and especially if you're going to locations like Africa, where you need a yellow fever vaccine. You have the uh, tick vaccine, you have the dengue vaccine, and you have quite a few vaccines now. So it's always good to keep that up. A dental workup is always better to have because it's one of the most easiest things to have a problem with and the hardest things to work in the field with. Other special considerations you want to think about is whether the client could be pregnant, is pregnant, could be breastfeeding, uh, because these increase the uh, metabolic load of the patient and therefore would may or may not be conducive to certain travel. Then any history of CVA or ACS, so any cardiac issues, any stroke issues, which you want to be thinking about, just so that they have access to uh, definite medical care, uh, and maybe uh, precludes them from undertaking certain missions and expeditions. Whether they're immunocompromised, again, depends whether it's in control or not in control and how bad their present state is. Any disabilities, handicaps, recent surgeries, these are important for you to know so that you can advise them appropriately. Certain recent surgeries might require a longer rehab, and any other autoimmune conditions that uh, can make it extremely difficult and painful for the patient in case they do have a flare up. Seizures and mental health issues. So we have a lot of uh, considerations when you talk about expeditionary travel of mental health, because a lot of people do recreate for better mental health, but at times you can also need psychological coaching when attempting certain more risky or more expeditionary like travel in the wild. If you are attempting records, you probably heard of a Major Preet Chandi who's doing her second polar hike now. I wouldn't call it a hike, but it's it's something which where you need to have mental fortitude and be able to achieve your goals. So it's a huge thing. It even for recreational athletes and recreational travelers, it's important to keep track of your mental health and be aware of what's going on. Now, when you talk about a demographic for a particular uh, wilderness travel, you need to think about quite a few uh, various uh, what should I say settings. And in this, it is not just a traveler by itself. It's not just age, but it's also whether they're traveling in a group and whether they're traveling independently. Because if you're traveling in a group, there's that support system which exists both for physical safety, mental health, as well as for having shared resources. Oftentimes you will have people carry multiple items. You might have redundancy in the group, and same goes for medications or first aid. And in the group you might also have a medical provider who is part of the team, and so on and so forth. Whereas independent adult or uh, travelers are more prone to, the risk assessment has to be a little bit more, so they're more prone to not having not carrying certain first aid or medicines, which again is dependent upon the person. If they're trying to do a light alpine hike, they might forego certain uh, items in their kit which may predispose them to injury or illness. Also, if there is a child, or if there are many children in the group, or traveling with a parent, it's important to do a full workup for them as well. Make sure that the growth milestones are being met. Make sure that they have access to whatever they need, uh, dosages, and tailor it accordingly. Similarly, for geriatric patients or geriatric clients, even though they might not have any history. You might want to be careful of and mindful of their physical ability, the amount of metabolic activity and physical activity that they can do. When it comes to sex, this is primarily to be more mindful about uh, about certain locations which are more misogynist and have certain requirements for dress and culturally significant. So it's important to be mindful of all these things as well, because those could turn into a threat for your traveler. Now, we talk about special populations in medicine quite often, where we talk about them being mostly pediatric and geriatric populations. However, I like to term special populations in wilderness travel as athletes, military, and media events, primarily because they have a different mindset and they have a different requirement. Ultra marathoners, ultra runners, people climbing for records, or people climbing uh, more than the 8,000ers. They're all extreme athletes, and therefore they would their concept and their requirement of taking risks is much different from the regular population. Similarly, for the military, there's a certain mission that has to be accomplished, and therefore the treatment and medical care that you would advise would be slightly different. There would be media events which you talk when you talk about covering uh, what should I say? You have television series, you have these alone and those kind of events. Again, those require different kind of treatment, different kind of medical advice. So tailor it accordingly and see how it meets their requirement, as well as and in the as safe as possible it can be. So when you talk about location, we have to think about the client's itinerary, and the order of travel is important because they could be going from a low from an urban area with high medical facilities being available to a location which could be completely rural. It could be, as they're traveling in the wilderness, we're looking at not just uh, completely in the wild, but also having possibilities where they're visiting villages where they have certain amount of population in smaller towns, and also areas which have different climate, area which have different disease and medical issues. You could have malaria prevalent issues, malaria prevalence in certain areas and not in the other locations. So it's important to have uh, a full itinerary of your client. It also helps you for immunization requirements, and like I said, disease prevalence in terms of particular diseases being spread out in certain areas, risk management when it comes to just having availability for definite treatment, prophylactics again based on your disease prevalence, excuse me, and of course the prior experience in the location. Now, prior experience in the location would also mean that the patient or the client knows exactly what kind of medical facilities exist, how they performed in that particular location, and also they would know what to carry and what not to carry. So there would be a much better understanding of their own personal risk and their own personal medical health, which they could share with you and probably even help you create a better program for them. Again, location, medical facilities, and team depends upon the guide and the actual location and the level of medical facilities available. Also, when you talk about the season and duration, it depends upon what kind of illnesses can be prevalent during that time, how long the client is going to stay in that location, and what would they need. Again, is the resupply of medications and resupply of basic food and water easy? Is water access, good potable water access, easy, things like that. Because if you look at a short term 3-day trip, it could be you could probably ruck out everything and carry everything yourself. But if you're spending an extended period, you might need to be self sufficient, you might need to have um, a resupply sorted out and things like that. And also, when you talk about accommodation, you're looking at whether it's tented, whether it is self-sufficient, what kind of hygiene you have, what kind of toilet facilities are you using, open wilderness toilets, or do you have portable toilets, or do you have a full proper sewage system. um, Travel advisories, depending upon what kind of area you are, whether it is conflict, or it is uh, any kind of sudden flare up for a disease. All these things would come in your travel under your travel advisories. Local liaison is extremely important in terms of getting around in a local area. um, your guides could be of certain assistance, but sometimes if you have a better liaison than the client's guide, it's always better to keep them a short phone call away, uh, just in case you need to intervene on behalf of the client in case of an emergency. It's also extremely important to remember that some of the prescription medications could be prohibited drugs in a different location, and could lead to arrest or even detention. And therefore, again, it's this is where a local liaison comes in. They could make sure that you get prescription medications through an official channel in that location, and you don't have to carry any medications or drugs that are prohibited in a new location. Now, animal contact is this is a very open-ended point, but it means whether you are going to have contact with uh, local animals which carry certain uh, parasites. You could have contact with wild animals when you're in the field as well. And it's important to be mindful of human animal conflict, and take care of yourselves and take care of the animals as well. When you're in the field, especially if you're living in uh, tents or living open in certain rainforests, snakes, small rodents, even frogs and reptiles are potentially dangerous. Not to just think about the larger animals, which are mostly highlighted. In the ocean as well, small hydroids, stinging hydroids. Uh, we're going to talk about marine envenomation and marine animals in another lecture, but uh, all these are important things to consider when you advise your client. Now, again, this is just something which is important to keep in mind as when you're advising your client. If they're going on a humanitarian aid mission, they would be in going to an area which is already resource limited, which means that their nutrition, their water, and their sleep arrangements are not going to be this as they are used to. They might not even be ideal in certain cases. Uh, Also, they have to be mindful of the fact that certain medical resources that have been taken there are for aid and not to be used by them. So it is better that they do not end up having to use them. So be safe and be careful so that the mission can be completed. Special missions, again, this is both military and recreational, and for certain record breaking activities. Uh, the kind of fitness level that you need to have for humanitarian and mission and special missions is different from just plain recreational, and therefore uh, the client, when you advise the client, you have to make sure that their physical fitness, their medical fitness is based upon the kind of activity that they want to undertake. So if you're going to be in a rural hospital as a physician or as a provider for an extended period of time, it's going to be in the wilderness. and you're probably going to be doing your long shifts without adequate nutritious food which you're used to, without adequate water, without having a soft bed that you're used to, so inadequate rest and things like that. All these things play into eventually having some kind of immune compromised situation which would cause you to be sick for any reason. Recreation again depends upon multitude of things. Is the client going hiking? Are they going climbing? Is it a safari? Is it a, what should I say, driven safari, or is it a motorized safari, or is it a hiking safari? Are they going to a altitude which would require additional fitness? Are they going diving or free diving? Is it a waterborne activity where they're going kayaking? Do they have adequate training for all these requirements? Are they physically fit? Again, going back to the guide, does the guide have adequate safety equipment? You're thinking about helmets, harnesses, um, s- good quality ropes, gloves in some cases, in cold water gear for special environments and special weather. Uh, is there adequate, again, nutrition, and even in these situations, is there adequate nutrition, and so on and so forth. Now, for specifically for medications, I would think about acute mountain sickness and anti-malarial prophylactics, acetazolamide, malarial. There are multiple ones over there, so I would say just look at what is available over there. Antibiotic ear drops, something which is I advise carrying. It doesn't cost too much in certain locations. You might get it over the counter in certain locations, but it's always better to carry a small tube or so. Antifungal and cortisone creams for your waterborne and tropical activities. General fitness and conditioning of your client. And uh, when I was talking about the waterborne activities, I was thinking more about kayaking and whitewater rafting. But also, there is risk of severe trauma from climbing, from altitude, from falls, and diving as well. So when you talk to your client and you consult with them, make sure that you do all of this and make a proper risk assessment, because that's what's going to help. And this is not just for a client, this is also for you when you travel. So this is just a couple of um, forms which I picked up from the internet, and they have medical certificates. The agencies have their own medical certificate depending upon where they are and what they do. So this is one I found for hiking. As you can see, it covers a relatively decent history. And this is not a complete form. I'm just showing you snippets of it. And it also indicates like this Sky Point climb is an Australian company. It has a very clear indication of what is required. So as it says, this moderate effort is required with fitness and strength levels suitable for traversing inclines between 30 and 65 degrees for approximately 110 meters at a slow to medium pace walk. So if you know how your client is, you can advise them based on just this simple first line. Number of stairs to climb is approximately 240, and so on and so forth. So even if you know that it's an adult patient, they're slightly geriatric, they're going to uh, visit a place which has stairs, they may or may not be able to complete the 240 stairs depending upon the incline. So simple things like this, you might want to advise them, um, and have a better understanding of what is required by just choosing and finding these forms available with the location where they're planning to go. This is from the Himalayan Mountaineering Institute in India, an extremely comprehensive form. It's available online, and here reason why I had this form is because it says the medical evaluation is valid only for 6 months. So it's one of those things which you need to keep mindful of. What is the last time the complete medical was done? Have they been evaluated recently? And what kind of evaluation was done? This has a full workup, which gives you a urine examination, blood work. Uh, it also has ECG and sorry, not ECG, a chest X-ray required, and it clearly gives you the uh, contraindications or the things that you cannot, the medical conditions that you cannot have in case you want to go and apply for the mountaineering course. For diving, it's pretty much the Recreational Scuba Training Council has a form which is also uh, what should I say? What's the word I'm looking for? It was vetted by the Divers Alert Network and in 2020, and it's a new form now, which is valid across almost all agencies have accepted this. It's also through the Undersea Hyperbaric Medical Societies. The UHMS also had a say in this. It's a multiple page document. Again, it has uh, indications for COVID, it has indications for any surgery, any prior issues. And then this is again a part of the form. The form is a multiple page form which can be downloaded on either the RSTC, the PADI, or any other agency's website. There's slight modifications to the form based on their logos, that's all. Otherwise, it's good. And if you see below the participant signature, it says if you answered no to all 10 questions above, a medical evaluation is not required. So in case you have yes to any of these, then there are separate boxes, of course, as you see A, B, C, D, which then go on to explain why you need to do what and what specific examination needs to be done. It also has a whole list, a 6-page list of what the physician or the medical examiner needs to look for in specifically to clear them for diving. For yachting, again, I found this form, which is based from the International Yacht Training. Again, it has issues here where you need to have hearing, so you need to have clear hearing without any loss. Should not exceed 20 decibels for the frequency of 500 hertz and 1000 hertz and 2000 hertz. Hearing aids might be acceptable, but as long as watchkeeping duties at sea can be adequately performed. So there are, excuse me, certain limits for different activities that you undertake. Also note in the red that it clearly says, please note that some conditions such as color blindness and epilepsy will restrict a candidate's ability to obtain a commercial qualification. And please contact MCA for further information on how certain medical restrictions may impact your career path. So it's important to have a knowledge of this, find out more if you're not aware. Knowledge is always good. So we come to risk management and mitigation. The primary things for any risk management is to understand what is the hazards involved. So hazard recognition or the risk recognition will obviously come in from you having a knowledge of what's going on, information, what the plan is. So you would need to have your medical history, you would need to have the itinerary of the patient, you would need to understand what's going on in the location. So you would probably need to understand and find out, sorry, what kind of political situation, what kind of medical situation exists in the location of travel, what are the what resources are available to you over there, and based on those uh, inputs, you would then create your hazard list. Based on the hazard list, you would then qualify it on a hazard level. So you first have to quantify what your various hazards are, then you would qualify them based on how uh, critical it is for that particular travel. Now, this is not just hazards in reference to the location, but it's also hazards with reference to the client themselves, uh, and their prior medical condition as well. So you kind of have to make a matrix that covers both these levels, sorry, both of these, and then you need to understand how you can mitigate those hazards. But I mean, simply for anybody who is not fit enough, all they need to do is start working towards their fitness, start working towards a better diet, improving their lifestyle towards fitness, making a conscious effort for, to be able to complete their activity that they want to. Simple things like knowing that the patient has a medical condition and carrying adequate medications for them. And again, once you make the matrix, it's easy to prioritize and list what work can be done, what activity can be undertaken. Also, having a backup plan is really important. So you always plan, and then you make a backup plan, and then you make a backup plan of that backup plan, and then you make a backup plan of that backup plan, and then you figure out what needs to be done when all of these can be used together. So your initial plan could be improved by just making a backup plans, uh, and looking at how comfortable your client is with a certain uh, itinerary and plan that you're making for them. The other thing would be to have a local liaison, having a plan as an emergency for basically an evacuation. Global rescue is one of those as well. Quite a few other agencies also offer uh, emergency evacuation plans. So keep that in mind. Also have a medical safety checklist, which would include your client's medical issues as well as any uh, local issues and local areas where they can go immediately. Food and drink, I think we've kind of covered this, but it's more about having safe nutrition, having safe drinking water, and making sure that even if you have adequate nutrition in terms of quantities of food, it's important to understand that certain people cannot and do not eat certain diets, whether it's religious, whether it is just palate, or whether it is their own uh, beliefs. So it's important to keep in mind that the client understands what kind of food is available, and if they don't, if they do and you don't, they tell you what kind of location it is and how it would be. Substance use is also pretty important when you're going traveling. There are some places, some areas which frown upon alcohol and tobacco consumption. Some places it is pretty rampant, and therefore uh, it's culturally important for them as well. And then you might or your client might end up not having a very pleasant experience, or an extra pleasurable experience, as the case may be. Sexual health is again important. There are communicable STIs and other communicable diseases. So it's important to, again, this would come into your uh, hazard recognition list. Again, road and crime safety comes into your uh, hazard recognition. Mitigation would be, maybe the standard, moving around in groups, having a local knowledge of the area, making sure that you only move out in safe hours, having a local guide if needed. Uh, One of the key things would be interaction and side effect of prophylactics that you take, because that's not something which you would normally be taking. So a drug that you are taking for AMS, for example, if you've not taken it before, you might want to take it and see how it affects you, whether you're allergic to it or there's any kind of reaction that your body has that is not any side effects which you want to start controlling or get used to. It's always good to have documentation for everything, and that includes all your medications that you're carrying, preferably a prescription, so that and if possible, try to get a prescription in the language that you are going to the location of travel, just so that even if you're going to pharmacy and they don't speak or read or write the language that you have your prescription in, they can understand it. It's good to have a copy of your medical history and pre-travel medical, just in case you need to uh, clear it. Also, copies of your immunization and copies of any other requirements of that area. Now, one of the key things is the whole continuum which I was talking about, and this would be your post-travel debrief. Now, bear in mind that you might think I've suddenly jumped to post-travel debrief, but the whole time that your client was traveling or has been in your consultation, there have been advisories which you have given them. So this is where it comes into a cycle with a continuum with you have inputs and recommendations as you go. But post travel is extremely important because people will return from travel and certain medical conditions only show up because of the incubation period being about 7 to 14 days. They only show up post travel, and if you have a history of the patient's or the client's travel, you can probably react better and provide better medical care to them. uh, Quite a few travel and wilderness travel requires extreme physical activity, and therefore there would be a certain amount of muscle wastage, certain amount of weight loss, and certain probable injuries which would not have been extremely evident at that point. So a good dietary and physical rehabilitation program is important. Uh, Again, mental health and social reintegration is extremely important, especially when you think about the fact that we are sensory gluttons, and nowadays with phones, smartphones, social media, having access to the world at our fingertips, when you go into the wilderness and you do not have access to internet or social media or any kind of social interaction in certain cases, or a completely different social interaction from the kind that you're normally used to, it requires certain amount of time for your traveler, your client, yourself to be reintegrated back into society, uh, having going back to the 9 to 5 if they do, or going back to their regular work, going back to interacting with the people whom they interact regularly. Mental health, again, they may have gone for travel to kind of forget, or maybe just have a better what should I say, a better mental health picture, and when they return, they could be back to their stimulus, it could be back to some triggering factors. So it's important that you have a proper debrief to them. Ideally, it says 7 to 14 days, but it depends upon client to client and what your relationship with them as well is. But you would definitely want to do one 7 to 14 days after. So to summarize, uh, like I was been saying throughout, travel medicine is a continuum. You need to follow up. You need to keep up with your client, and not just leave them the minute they depart your office and say, I'll see you when you come back from your trip. It's important to have a good history of your client and of the local knowledge, of the location where they're going. Have a good local knowledge, probably get support and local liaison. Think about the activity, duration, and location that they're going to. And we spoke about risk management and mitigation with proper planning, making your hazard matrix and stuff like that. There are quite a few travel and expeditionary medicine courses. The College of Remote and Offshore Medicine offers one. We have people just travel. I mean, just travel will make your medical knowledge base improve and your activity base improve. Go out in the wilderness, have fun. Any questions? I'm just going to stop my screen share and we can go to that. And any questions? You can just unmute yourselves and go ahead. I'm not sure if I'm also sorry that I couldn't track any of the chat messages. So if anything came up, I did not look at anything of that. Abrik, was any questions as I was going through?
No, I've been keeping an eye on it, Vish, and nothing. Just a comment now from Eric, but just no questions in this.
Thanks, Eric. So any questions? I mean, I don't think there was anything complicated. I wanted to put in a couple of case studies, but I felt it's already getting a little bit too long. We can probably do that in another talk, maybe.
That's perfect timing. We're right at 50 minutes.
So any questions about the college? Any questions about the form? Any questions?
Christopher War has a question in the chat.
Let me just take a look. So Christopher has a comment. Hi, Christopher. Question is, what are your thoughts on local treatments that conflict with your knowledge? I would say any treatment that you have to do for your patient, this is now when, if you are in the field with the patient, or is it when you are advising them from a remote location?
I was thinking, either something happens on an expedition or something, and you have to recommend that they go to get treatment, but the treatment that's available is not what you think would be the best, but that's just a treatment. Would you rather try and treat and manage your clients yourselves, or would you rather try and refer them out or get them evacuated? Because their treatment strategies and paradigms vary dramatically based on where you are.
Right. So this is a very interesting question, and brings up a couple of things. One is, if you are with them and you are in the location and you do not have the resources for the treatment, and you need to refer them to a hospital or or definite care locally, you are not, unless you are medically licensed, then in which case you would be medically licensed in that area to be able to treat the patient. So then, even if it is local, you can supersede and override whatever is being advised. If not, if A, you are not in that location, and B, you are not, even if you are in location but not medically licensed for that area, you would have to defer to the local licensed medical practitioner. And then, if you do not agree with the treatment, or you feel that it's going to harm your patient, I would say step back, and get the patient either evacuated or continue on the mission based upon your prudence or your judgment of whether it should continue or not. Because if it's something which is life threatening, you want them evacuated in any case. If it's not something life threatening, if it's an infection, and or if it's a allergic reaction that is not anaphylactic, and you want to treat it accordingly, and they're not doing it, it's your call. Are you willing to take that risk of maybe it might not, it might lead to an evacuation, or should you stop the trip altogether? So it's a slight bit of a catch-22, but I would say it's very clear in terms of medico-legal practice whether you can or cannot. But it then comes down to what would you think as a prudent medical provider to evacuate, to stop the mission. Bear in mind that there's a lot of costs that go into some of these trips and missions. Like a simple trip to Alaska, or to the to see the northern lights in the Arctic or Antarctica is pretty expensive. It goes into few hundred, few $1,000s. So would somebody want to pull out and spend so much money on evacuation as well, when they could probably be treated locally? So that's a catch-22 situation which you are in. That's my opinion. Yeah, Abrek, what would you say? You've been in more remote areas than I have.
Yeah, scope of practice is tricky, isn't it?
Yeah.
And the college is adamant about making sure that you're licensed in the country you're in. And some countries have good Samaritan laws. So if you have someone in anaphylaxis and you give an EpiPen, you're covered. Some aren't, but you definitely have to be careful on where you are. So we send a lot of guys to Tanzania and to Kilimanjaro, and they're working under the license of the local docs. But as soon as they leave the hospital, they can do nothing. So yeah, that's a challenge that you got to deal with in the wilderness. Ian Forsyth has a question.
Hi, yeah, just leading on from Christopher's point there. I've been involved in telemedicine quite a lot, and I'm just sort of thinking of the scenarios I've been in. Implications for insurance, the medical insurance. If we had a situation as Christopher is looking at, where the in-country treatment maybe doesn't fit with our knowledge, protocols and things, would a possible option be to, contact the medical insurance and use them to, either telemed or seek home nation advice? I'm thinking non-life threatening, non-anaphylactic, sort of illness.
That's a good way of doing it, because if the insurance company does have, again, that's where your local liaison would come in. And whenever you've operated in locations which are beyond your scope of influence, it's important to have that. So medical insurance company, not medical, even global insurance companies do have that kind of a system where they will have a local provider who will liaise with your client for their requirement. So you could have a telemedicine consult with the local provider and ask them to, provision that medication if possible, or that treatment if possible. But it would be, again, depending upon whether that location does have that legally or not. Like Penthrox is not legally authorized in India.
Yeah, understood.
So yeah, so if it's a sudden emergency, you might be carrying it in your backpack, but you can't use it, or things like that. It would be a legal issue.
Yeah.
Just to give you an example, I had a ear infection when I was diving in Florida, and I did not carry my ear drops, and I had to go to walk into a medical store. And in India, you can pick these up over the counter for about the equivalence of 5 to 10 cents US. I walked in and I had my insurance, but they refused to accept it because they wouldn't accept that particular agency's insurance. I had to pay out of pocket. Eventually got what I needed, but it's even, insurance issues can come up when the immediate treating facility will not accept cashless insurance. I was reimbursed, but it's just example to give you that even if you do have insurance cover, it might not eventually be cashless or might not suit your requirement. So it's, like I said, it's a catch-22 situation that you have to play by ear, as long as it's not life threatening. I would say, take a call based on the best available input.
Yeah, Roger. Many thanks.
we have about 6 minutes more for any question and answers. Any questions on, like I said, the college form, on us, on what we do? I'm happy to answer. Any questions on the future of wilderness medicine that you think about? I would like to have a discussion with. Sure, go ahead. The ISTM was a pretty decent resource, which I found, and even the CDC prep was a pretty decent resource. It's nice. Information available is easy to comprehend and see. It shouldn't take too long for anybody creating. And while the ISTM does have a paid membership, the CDC, everything is available free. The yellow book is paid for, but you can read sections and screenshot sections if required, which have a lot of information. So that's a good resource to have. But my key takeaway is always have somebody local whom you know, if possible.
Thank you all very much. I've got to go to another meeting today, but I really appreciate all this, and have a good day.
Thank you for being here, Chris.
Yeah, we can bring this to a close. If you have any questions, you can email the college, or you can email Vish at v.rajan@quorum.edu.mt, and we will see you on the first Tuesday of January for the next Quorum WMS SIG. Thanks for coming.
Thank you, everyone. Thanks, Yabrik.
Yep.